people are suffering beyond what is biologically or whatever wrong with them, and they shouldn't have to have extra suffering.
As if their suffering wasn't bad enough already.
Exactly.
You suffered your own ups and downs with your treatment. Massive frustrations for you and your family. Explain those.
Basically, when I was 13, I started to show my symptoms for bipolar, rapid cycling bipolar. And when I was 13, I didn't get any really help from CAMHS. I wasn't picked up by CAMHS. I wasn't... the only help I did get was seeing the school counsellor, which for me was pretty ineffective. And my parents didn't know what to do. I mean, like, I had never heard of CAMHS. I didn't really understand mental health. I wasn't aware that there was anything called bipolar, you know, and it was hard.
And just explain for us what CAMHS is, for those people who don't know.
CAMHS is Child and Adolescent Mental Health Services. They cater at the moment from people aged up to 18, and then you get moved on to AMS, which is Adults and Mental Health Services. I
think, as Lucie, all these things, you know, they're new to a lot of people who then might be presented with their child who they love going through something like bipolar, and they just won't know what to do. It's not necessarily the case that the services aren't there. They won't even know how to access them in the first place.
Yeah, that's right, yeah. And it is difficult to access services, and what has been happening over the past few years is very long waiting lists for treatment. So the first thing to do is to go to your GP if you're very worried about your child.
Yeah.
And some GPs are brilliant. Some GPs aren't very good at talking to young people.
There needs to be a focus on GPs recognising this kind of thing, right?
There needs to be a focus on GPs, on teachers, on youth workers, everybody who cares about the welfare of children and young people.
But essentially, no one knows that young person better than themselves and better than their loved ones or, you know, parents or carers, do they?
That's right. And so it's also about skilling up parents to help them to understand how to... Because teenagers can be very difficult.
Yes, of course.
So it's about skilling up parents so they understand how to keep the channels of communication open with their kids, and also to spot the signs when they may be struggling.